Good morning from Sydney. This is my personal story of living with high blood pressure for 10 years and what happened when I changed my diet and lifestyle. I want to make it clear from the beginning. My experience is not a promise that everyone will achieve the same results. High blood pressure has many possible causes, and each person is different. I am sharing what I did, the scientific evidence that guided me, and the results I observed in my own body. ChatGPT helped me find, understand, and discuss the evidence. Together, our aim is simple. We research, we suggest, you decide what may be appropriate for you. For nearly 10 years, I was treated for what was called essential hypertension. I took blood pressure medication, Covasil, but my readings remained around 150 to 160 over 90 to 100. Halfway, my medication was doubled to 5 milligrams, and in 2024 was advised to take even more. The treatment was focused mainly on lowering my blood pressure reading. But I began to wonder, why was my blood pressure still high? What might be driving it? With ChatGPT's help, I began examining the scientific evidence and looking beyond the number. I explored possible connections with excess weight, insulin resistance, diet, sodium and potassium balance, and the health of my blood vessels. Based on what I learned, I made 4 major changes. First, I tried to reduce my fasting insulin by eating real, minimally processed food and reducing refined carbohydrates. I used the same diet, 6 by 6, with 6 essentials which we've been suggesting. Second, I improved my sodium-potassium balance. I ate no processed foods, which reduced my sodium intake, and included more leafy green vegetables, naturally rich in potassium. Third, I supported nitric oxide production by humming, eating rocket, beetroot, and leafy green vegetables. Nitric oxide helps blood vessels relax and widen. Fourth, through the 6 lifestyle changes that later became the foundation of 6+6, I began losing excess weight. These changes work together. I'm not simply trying to lower a number. I was trying to improve the conditions that might have contributed to my blood pressure. I did not make these changes blindly. ChatGPT helped me find and understand 3 important areas of scientific evidence. The first was the 2015 study by Ashi and colleagues. It found that higher fasting insulin and insulin resistance was associated with the later development of hypertension. This did not prove that insulin resistance was my only cause, but it gave me an important possible explanation to explore. The second was the landmark DASH trial, published by Appel and colleagues in 1997. It demonstrated that a dietary pattern rich in vegetables, fruit, and other minimally processed foods could meaningfully reduce blood pressure. The third was the TONE trial, published by Welton and colleagues in JAMA in 1998. It showed the importance of weight loss and sodium reduction in controlling blood pressure. This was the evidence available to me in 2024. I applied these principles to myself, monitored my blood pressure carefully twice a day, and observed what happened next. Now came the part that surprised me most. Within 7 days of changing my diet and lifestyle, my blood pressure fell to around 100/60 on medication. Because the reading had fallen so dramatically, I personally stopped my blood pressure medication and began monitoring my blood pressure 3 times every day. My pressure came normal and remained for the next 20 months. Till today, I am medication free. But please, listen carefully. This was my personal experience. It does not prove that insulin resistance was the only cause, and it does not mean everyone will experience the same rapid response. Please do not copy my decision about medication. Blood pressure can fall quickly when diet, weight, and lifestyle change. Monitor it carefully and discuss medication adjustments with your doctor. When I told some of my medical colleagues what had happened, they said perhaps I had been lucky or that it was a miracle. At first, I did not have a clear explanation for such a rapid change. Then a couple of weeks later, I heard Dr. Roshani Sanghani, an American board-certified endocrinologist practicing in Mumbai. She explained from her clinical experience in patients in Mumbai, when insulin levels falls, the blood pressure can sometimes fall too, and that patients need to be monitored carefully. I smiled because this was very similar to what I had experienced. Her explanation did not prove exactly what had happened in my body, but it helped me understand that my rapid fall in blood pressure was not necessarily a miracle. This was a possible physiological explanation supported by her clinical observations and the scientific evidence I had already found. Now, what is the evidence today? What is particularly interesting is that the lifestyle principles I applied in 2024 are now clearly reflected in the 2025 American Heart Association and the ACC high blood pressure guidelines. the guidelines strongly recommends a DASH-style dietary pattern, reducing sodium, increasing dietary potassium, achieving a healthy weight, and being physically active. That's the 6+6 program. It also recommends managing stress and by reducing or avoiding alcohol. For most adults with hypertension, the treatment goal is below 130/80 millimeters of mercury, although treatment must always be individualized. This guidelines does not say that medication is never necessary. Medication remains important for many people, but it clearly places dietary and lifestyle changes at the center of preventing and managing high blood pressure. That's why we are encouraging people to follow the 6+6, a healthier you. That's what I used. Let's look at the latest evidence and a South Asian warning. The latest research makes this message especially important for South Asians. A 2026 study by Pedamalu and colleagues found that by the age of 45, South Asian adults already have a high prevalence of hypertension and prediabetes compared with other ethnic groups. A second study by Q and colleagues followed 25,820 people with hypertension. Those with healthier lifestyles had substantially lower risk of cardiovascular disease and type 2 diabetes. Because this was an observational study, it shows an association rather than absolute proof of cause. A recent review by Matsumoto also highlighted the importance of nutrition, sodium, sleep, and other lifestyle patterns in managing blood pressure. It all comes down to 6+6 equals a healthier you. The warning is simple. South Asians can develop hypertension and metabolic problems at younger ages, even when they do not appear overweight. We should not wait until complications appear. Screen earlier. See your doctor. Understand the risk and begin appropriate lifestyle changes earlier. We've explained the 6 lifestyle changes. It is simple. My take-home message is simple. Lifestyle can make a meaningful difference. I used it. The latest evidence shows that essential hypertension can often be improved through dietary and lifestyle changes. But the appropriate approach will be different for each person. Discuss the evidence with your doctor. Ask questions. Understand your choices. Don't just accept more medications, and make the changes that are suitable for your body and health. If you have any questions or find the scientific evidence difficult to understand, ask our educational partner, ChatGPT. You can ask privately, 24 hours a day in any language, but use it for education, not as a replacement for medical care. Most importantly, monitor your blood pressure carefully. It can fall rapidly. Never reduce or stop blood pressure medication without medical supervision. We research, we suggest, but you must decide. This is only part of my health journey. I had 6 metabolic diseases. What I learned about insulin resistance, blood pressure, weight, diet, and lifestyle change changed my understanding of health. I now share what I learned, what helped me, so that others can examine the evidence and make informed decisions for themselves. I do not make any money from this. I do not endorse any products, and there's no subscription. Our purpose is to help you regain your health again. On my website, You Eat Safely, you can explore our free health books and educational resources. There are 40 books I wrote, or we wrote. They are offered in their original, unedited form, so you can follow how our understanding developed over time and examine the references for yourself. It was written in simple English with hardly any medical jargon. Remember, everything is free. We have no products to sell and no commercial endorsements. If you do not understand something, ask ChatGPT to explain or to translate it into your own language. Then discuss anything relevant with your doctor. You can also contact me. I'm happy to help anybody, anywhere, anytime. Please continue learning. Keep asking questions and take an active role in your health. It's your body, your future. Thank you for listening. I'll see you in the next video.